Good morning, Baltimore. Welcome back to Med Talks. I'm your host, Sarah, aka The Tuna. Today on Med Talks, we will be discussing cancer, in particular, one of the more rare forms of cancer, osteosarcoma. Today, joining us, we have a newly diagnosed patient, Amanda Falcone,
Thank you for helping us make this rare cancer more known to the public.
and our oncologist, Dr. Marissa Benjamin, head of oncology at Johns Hopkins Hospital.
Thank you for having us, Sarai.
Thank you both for joining me. Amanda, I would like to start off by asking you how you were diagnosed with this horrible disease.
Well, I was painting a room in my house and I fell off a ladder. I broke my arm and had to go to the ER for x-rays and blood work. That's when one of the doctors noticed my blood work was a little out of the ordinary. After doing tests, they referred me to Dr. Benjamin, not knowing exactly what was wrong.
Yes, I did notice in Amanda's CBC the white blood cell count was elevated. After further tests, we found cancerous cells in the bones of her broken arm. This is when I was able to diagnose her with osteosarcoma, which is a bone cancer found in the growth spots, primarily in the bones of the appendicular skeleton.
Oh, I'm so sorry to hear that, Amanda.
I'm just glad they found it before it got to a point where it could have been untreatable.
Well, I did my research on this cancer, and it seems like there's not really a particular treatment. Dr. Benjamin, what have you prescribed Amanda?
Well, in recent studies, methotrexate, commonly known as Trexol, is a chemotherapy drug we use to treat this type of cancer. Based upon the medications she was already on, the drug was most compatible. It is in the family of anti-antibodies, which are anti-immune suppressant drugs.
Some people might not be as familiar with methotrexate or Trexol. What are some of the more common names?
Well, there's Trexol, like I mentioned, but there's also Rasuvo, Rumatrex, and a dose pack.
Interesting. Amanda, how was this drug given to you?
Well, I first started taking the oral medication, but I was not able to keep it down. We decided the better route was a 12-gram injectable solution through an IV in a 4-hour infusion.
This dosage has worked remarkably well. There's also a compound powder we could try that turns into another solution.
Wonderful. Based on my research, methotrexate enters the cell through an active transport mechanism. This is just the way the drug enters into our tissue. Once inside the cell, it is converted into polyglutamate methotrexate. Can you explain the further process of this drug?
Of course I can. In your body, you have things called purines and pyrimidines that make up your DNA. MTX basically stops an enzyme called DHFR, which is reduced folic acid. This leads to a lack of purines found, primarily thymine.
From my understanding, because there's a lack of thymine, DNA cannot replicate properly, which causes methotrexate-induced cell death. Is that correct, Doc?
Oh, look at you doing your research. Yes, that is correct.
Well, I try. Does methotrexate affect one's immune system?
The way MTX applies to Amanda's condition is with the help of ATRA, which is all trans retonic acid. It can enhance the differentiation of osteosarcoma cells. And to answer your question, yes, it does affect the immune system because it reduces T cell and B cell activation, apoptosis cell death of activated T cells, and less A and B production.
Differentiation in cancer cells is a good thing because they behave more like normal cells and tend to grow and spread slower.
I just want to say I've never seen more cooperation between doctor and patient. Dr. Benjamin, I'm glad you care so much for Amanda, and Amanda, it seems like you can really trust Dr. Benjamin to help you through this tough time in your life.
Thank you. I do believe patient-doctor communication is key in this fighting process.
Amanda, how about you tell us some of the more side effects you experience?
Well, you can clearly see I lost a little bit of hair, but mostly after my infusions, just a loss of appetite and feeling nausea, and really fatigued after. I was advised that my immune system would be suppressed, so I have tried to avoid getting sick at all costs.
Lucky you, I just got over a massive cold. Dr. Benjamin, what are some of the more serious side effects to this drug?
Blood in the urine and stool, coughing up blood, swelling of your legs, reddening of the skin, toxicity in your bone marrow, liver, lungs, and kidneys. But it does take a little while for your body to adjust to this medication. The side effects should go away, but if they don't, you should immediately tell your doctor.
Well, I just want to say that I learned a lot today, not only for a rare form of cancer, but about its actual treatment, which you don't normally hear about. Thank you, Dr. Benjamin, for taking time out of your crazy schedule, and thank you, Amanda, for telling us your story. I want to wish you the both best of luck on your ongoing battle.
Thank you for having us, and I'm hoping in the future there will be more studies of methotrexate and other ways this drug can work.
Thank you for having me, Tuna.
This has been Med Talks with the Tuna. Tune in tomorrow for a special on heart attacks.